Good afternoon. First of all, thank you very much to invite us to share our experience as healthcare navigators. My name is Ximena Montero, and today I'm going to be presenting Oncoguia program of patient navigation here in Chile. Before we start, we would like to have a conceptual of cancer in Chile. And part of this is the what we find when the challenges that we find since there is registered in this cancer is the first cause of death here in Chile. Here, this is principally because in the context of pandemic, people do not take preventive care. What impacted people who have more advanced um, in access and opportunity. Every hour, 3 people die of cause of cancer, and at least one of them is that because of delayed or treatment or diagnosis. Another of the challenges is that the public health system is a fragmented health system. There exist different healthcare facilities where the patient goes and transits through them. The difficulty is between that these healthcare systems are not integrated, and what impacts the health of the person with their healthcare, that becomes a problem. What is the problem is the problem with the diagnosis with the patient that is the healthcare system that is now fragmented and complex with 10 or 5 sections that goes through all his process within the experience and that we have had as a navigator hearing to the voices of the patients. What more impacts them the most in first instance is to be in the waiting list, which generates high levels of stress, because the cancer could advance in this its wait time. And also we could find that the impact, psychological impact in family that it generates among them and their family in response to all these necessities. That's why Oncoguia is born and why this is a social initiative, free and created by Arturo Logi Perez organization. Our mission today is to see how the patient in Chile is treated. What do we offer? Do we offer? We offer to the person in cancer and his surrounding healthcare care that helps them to go through the illness, and they can access the services that are according to their condition. How do we work? How do we work every day as navigators? We work hardly, and we have focused on these last year to professionalize our services. All this, us as navigators, we have been trained in the training of international model, and that we have been adapting to the social economical society of Chile. For us, it's very important today to be of support for the community, and like that from Moncovia, we are looking to be a partner with and right now we are doing routes that from the moment that the patient has we suspect, and we have this route to identify what are the barriers, biosocial barriers that they have, and that we need to offer them assistance as a navigator. Together with this, and that we work and that we partner with public and private organizations, we give them the support that the people need, and navigators that are in distance. Sometimes we have a multi-channel long distance services for the person could contact us via phone, WhatsApp, and also through our webpage. What do we offer? Our objective is the adult public. We do also navigator. We not only take care of the patient, we also take care of the family and people who are support. Our services are focused in giving them information of what are their benefits and opportunities that they have in the healthcare system. We connect them with different webs and we have also volunteers in the interdisciplinary volunteers for the psychosocial, and also we give them information regarding cancer. I would like to tell you how is a day of patient navigator in Oncoguia. First of all the actions that we do as navigators are centered in the person to offer them an individualized service. And that's very relevant for us. We designed um, profiles for the patient who's taking care, and probably the person that takes care does not have the same experience. We start differentiating what we're going to do. If it's digital, we also design a, care protocols. For us, it's very important that we look through three places: communication, remote, independence to take care, and information about the cancer. So for the registry of our services, today we have a platform which we have designed where we register all the information, qualitative information, quantitative, and social demographics of the patient. Like that, we could analyze systematically which are the various psychosocials that the person have through the illness. We have interaction. We send them a survey to detect what are the things that we have in the interaction with the navigator. And one of them is that we have worked very hard this year, as that weekly we meet and we supervise each case, and we make and to end with this reflection is regarding our own practice that we have been perfectioning as a navigator. We know that the type of user that we have are people that are having a high stress of stress, physical, psychological, emotional, and social. And in this context, we find the challenges that we have people that have high levels, and the challenges that we confront, and that we need to inspire them um, fluidity, and also be conscious of our own emotions, taking care, not projecting these or our experience over the user. We need to transmit that we have been thinking in the role of the navigator. It's important that we train and that we have professional competency, but behind every navigator there's another person that also things happen, and these things that inherent see their objective when they interact with the user. In Oncoguia, because of this view, we have proposed to keep on training our service with professional training, and we want to visibilize the necessities like that we could develop our personal abilities to which require auto-conscious, continuous reflection regarding and self-care. Some way in the measure that we're conscious of ourselves, we are better prepared to take care of somebody else. And we believe and we think that we could give a better service. Thank you. Thank you very much for this opportunity. My name is Silvia Xinico Akuk. I am the coordinator of Alianza de Mujeres Indígenas because of nutrition, and also facilitate process for us. It's an honor for us to participate in this first Congress international, if this NPI, First International Congress, to know about the experience of each country and each institution that they're doing. And I greatly appreciate this opportunity. And I would like also to, as an experience, also as a navigator, patient navigator, as my personal experience that I had with my son or daughter, like navigator, we also need to have a high self esteem and see how we could also help more people uh, in the community, family, and of our country. Same as a patient navigator. Unfortunately, in Guatemala, there is very little information of what is the route of how to help people with cancer. In Guatemala, we do not have a protocol that it can be promoted or that is being promoted of what is the route. For example, if a person in the community gives the information that he has cancer, but they don't know where to go and how to do something about it. So there's not a lot of information about that. So we have seen that this is something that we need to have a route. And that somebody, uh, and also that we could also do a way to take care of the patients, especially in the local language. Most of them do not speak Spanish, and they only speak a local language. So we also need to create this process. And also we need to create the trust among people to see if we can take care and explain what are the possible routes that they can have as well. For example, the people who have a job and people who could have a stable job, they could have access to public health in Guatemala, and EAPS could help with some treatments if they're children or young people. It would be La Uno Plus that could take care. And just like that, the Hospital San Juan de Dios and Hospital Roosevelt, there are only the two national hospitals that could take care of people with cancer. And when I navigated, or when I'm navigating, there is a lot of people from Pepén y Saral, from Huetenango, that are departments that are very far away from the capital city, and the Incan, that you have heard the experience today in the morning. The Incan, these institutions that are giving these services, but they are in the capital city. So we also need that this process, this verbal process, could be at the local and departmental, and the information to the patients that could have this type of process in all the route, that it's more at municipal level or department level, because unfortunately the people see that they get up the day before in order to get these type of services. And also we have to differentiate it among us patient navigators, and this is how we can create this trust and that peace among the patients, to us, how they could accept, or how could they understand this process. Because I know that when we're cancer, we think that cancer is not curable, or that it will take us to death. I think that there's a lot of processes that could take us, and that we need to verify all this, because like that, as an organization, we are working on a route like that. we could mention to the people where to go when they have and patient navigation that we're doing is being seen, and we're trying to accompany, because in Guatemala, when we see when the patient delegation of patient that is called patient navigation. Before we used to call it um we used to take care of the patient, and we take them to accompany them to the doctors. And right now, with all the certifications that we have, um we already know this other concept or this other method, which is called patient navigation, because that's what we do in the healthcare services, and what way we can get all these healthcare process and see with them in this process inclusive. There is a very important process that my daughter lived through this, is the psychological process. I believe that even the person who has all this process, like the family or or the close friends, the psychological process is very important, because this makes the patient get stronger, and also the family, inclusively the psychologist is it is a very important component, because they give us the strength to accept and to start the treatment. And I also see that we could see positively and see in what way in this process. I know that they are sometimes at the patients that see ahead, and we need to create the peace that they have, and us as navigators, while the family, and that we could go by, and that. Thank you very much, and I'm here for any questions. Thank you for being here, and please wait for the end. Thank you very much.
Hello, everyone. My name is Vanessa, and I am Oncoguia's Lay Patient Navigation Coordinator. We are a cancer patient advocacy organization based in the city of São Paulo in Brazil. And today I will share a little bit about the Lay Navigators experience. So our program takes place in 2 public health hospitals in São Paulo. We have 4 female lay navigators who are divided between the 2 facilities. So our program was launched 1 month ago, and we have been assisting patients with female tumors recently diagnosed, and with disease recurrence. It was a rewarding experience for all of us, and the navigators are really happy to help the patients, and day by day they are more motivated to make a difference in the health system and in patients' lives. And all of them are in love being a cancer patient navigator. So some of the patients do not know if they want to participate in the program, but after a conversation with the navigators, they feel welcomed, protected, and have the feeling that they are not alone in the cancer journey, and feel free to talk about their perspectives about cancer and their fears. One of the patients sent a message for us and said that she felt safe and important when she talked with the navigators. And a family member sent another message to thank the navigators for the help, and said that what they are doing is very important to the patients and families, and he had never seen something like this before. So we are very happy with these responses. The navigators have already seen many challenges in 1 month. So, for example, they helped a lot of patients who needed an image exam to decide their treatment and had to wait for 3 or 4 months to do these exams. And with the navigator's help, the patient was able to schedule the exam within 2 or 3 weeks. We also have learned that many patients felt lost and overwhelmed, and the navigators are the only accessible resource they have. So they text or call them just to talk about the day, how they are feeling, to thank again for the navigator's help, or to ask difficult questions like, what should I eat before my first chemotherapy section? Or I'm in so much pain, what can I do? Please help me. And these are difficult questions for the lay navigators to answer. Another experience that the navigators have had is that it can be very difficult to talk about some of the barriers the patient is facing, because our navigators first meet with these patients is right after they are diagnosed. And at this moment, they have a lot of information going on, so they can think about any barriers. So what we do is a day after the meeting, the navigators get in touch with the patient to ask them how they are feeling, and just to let the patient know that they were remembered. And after this conversation, most of the patients feels comfortable to send text messages to talk about their difficulties in life and barriers that will impact in their treatment, like lack of food, no money for transportation, and then the navigators are able to help the patients more and address their needs. So this is what we have experienced after 1 month of our program, and we know there will be much more to learn as we continue to help cancer patients in São Paulo. So thank you very much for this opportunity.
Here today to highlight the work we have been doing with cancer patients here in Belize. As a patient navigator, I hope I will be able to show our reality of cancer care in Belize, to share my experience on a one-to-one daily contact with the patient, as well as sharing my hope for this program. Cancer is among the leading cause of death in Belize, and it is the second leading cause of death after cardiovascular disease. However, it is the first leading cause of death in women of productive age. Many of our patients are coming in with cervical and breast cancer in an advanced stage. Cancer care is a challenge. It is due to many factors. Up until 2021, there was no public cancer care facility in Belize in the healthcare system. This is when our first public oncology unit was opened. Before then, this meant that our patient had to travel abroad for diagnostic testing and for treatment services. We lack resources such as screening, staging, and diagnostic that are not readily available. Patients had to travel abroad, which leads to financial toxicity. A large portion of our patients are in need of palliative care. Sorry. And I lost my thought. That is palliative care that is not readily available within our country. It is a struggle. We don't have access to pain medication. Our patients are suffering. Over 40% of our population live in poverty, unable to access diagnostic tests. Therefore, treatment facility is a challenge due to financial constraint. As a nurse navigator, my roles are many in the clinical aspect. I participate in consultation. I am there to support them in difficult times. I also directly assist during chemotherapy infusion to monitor and reassure them that we are there for them. I do active data capturing on a barrier to access care and inputting this information on a ComCare platform system. We educate the patient of importance of treatment and potential side effects. Also, the importance of compliance to treatment and follow-up visits. We advocate for patients and liaise with different organization for assistance financially, socially, and spiritually. As a nurse navigator, it is not merely treating disease, it is treating the patient and the family. It is a holistic approach. We let them know that they are not alone. We are here for them if they need our help and support. We are there to support them throughout this journey. I can say that I never chose this job. This job chose me. We are the main point of contact between patient and the oncology team. I ensure them that we are just a phone call or a visit away. Serving as a navigator. Just one moment, sorry. Serving as a navigator has enabled trust in the healthcare system. In turn, we have created a sanctuary for all our patients and their families who are in need of a shoulder. I would like to say that a diagnosis of cancer is a life-changing situation. No one should be alone. It is a battle. I hope that every Belizean could have accessible and affordable health care, and for one day that we'll be able to offer radiotherapy to our patients here in Belize, that they don't have to travel abroad. And also for the palliative care to be more readily available to ease the patient burden. Being a patient navigator is long-term care. It is an essential service. And I believe that over 500 plus patients that we're seeing here, that patients should have access to a navigator. It is about the best interest for the patient and for their family. Thank you.
Good afternoon. Like everybody said, my name is Tatiana Rivera here in Puerto Rico. For me, it's always a pleasure and an honor to be with you in this first Congress of navigators and what we could do from our regions. And it has been a lot of value to know what each one of you are doing. So I think that we have spoken a lot of things for me going just to close, and this is the last presentation, so I'm not going to take too much of your time. The navigation in Puerto Rico as a service has been here for a very long period of time, but as a concept, in many occasions, it requires a lot of education and to re-educate the staff, medical and multidisciplinary teams and other healthcare professionals. Additionally, it requires a new person that is this added to the life of each patient and requires the education to let them know what is our job and why our job is important and why it's important to have a navigator once you have a breast cancer diagnosis. For us in HIMA San Pablo Caguas, I work since 2020, since 2020, but as a program specifically and development, we are since December 2022. So I could all mention a couple of things that we have found through the way that have been challenges or strategies that we have been able to implement and that have given us an experience in the process of navigation. So we can identify as patient necessities that patient have identified that they require centralized service, that all the services are given in a specific time, like that they will not get lost through the healthcare system. Additionally, one is the reduction of time, the wait time in between specialized treatment and testing. Also, a necessity that everybody have is to put to understand at least the basic of their pathology. What each one of those markers mean. One of them is for the emotional, like I have mentioned, understand the basic elements of the illness for the management of the diagnosis. Two reasons. One, for the emotional that an illness like cancer brings, and two, to they could explain it to their loved ones and explain that to their loved ones is an additional job because it includes orientation and inform children, teenagers, couple or father, mother, or somebody that in front of the shock do not know how to explain it. And it's part of our job, and it is part of the necessities that we have understood as part of our experience. What we have tested, and while we're developing the program, we have tried many things. One of them is to understand a form in each encounter with the patient, in each interview with the patient. I write what is the next thing that he's going to need. If he has an appointment with the oncologist, we write the where the appointment, what is the phone number and extension number of that office that he requires. Like that, they will not get lost in the healthcare system. And that design of this form comes because at the beginning, patients have referred, have said that they have forgotten or lost what was mentioned while they got out of the office. So the form minimizes that the patient get lost among the healthcare system and then receive the service that they need for their diagnosis. Also, it's easier if you have the form where you're going and you not remember the information. You can ask somebody at the hospital if you do not have the navigator at some point. Something that has also worked because of the pandemic. They do not allow patients or people to go with the patient, and in many times the navigator needed to be with that patient for what? To be able to reduce the stress and the patient feel secure because somebody external that could understand and that they could know that after that session with the doctor there's going to be a translation of what happened. Additionally, we also help patients to develop a list of questions. Sometimes the patient not necessarily can say, because what we has, and with the patient we develop a list of questions to be able to identify things that require attention at the moment that it's needed. Our challenges is that we do not have enough specialists, and that is as consequences, people do not receive all the services or high co-pays and health insurance with organizations and foundations. If we get the money, we necessarily sometimes there's nobody who does the studies, and very little times we speak, and sometimes we lose patients through the way, and we lose them because they're in the terminal steps, and sometimes this the patient navigation is like ride for the patient and for the navigator, because sometimes you feel that you feel happy and sometimes like, sad, and that would be it. Thank you very much.